Welcome to this screencast on problem-solving questions. The objectives of this are to look at why we need a screencast and to help you go through problem-solving questions, or PSQs as they're more commonly called. So the reason why we have this is every year we have some students give us feedback, one of the things being increase the word count. It is important to remember that this is postgraduate education and you do need to learn where necessary to work to a concise word count. There is no leeway with this. If you go over the word count, you will be asked to resubmit your work and the resubmitted work will be capped at 50%. Other feedback is that the cases we give you are unrealistic. Every patient in the PSQs is actually a real patient that has been seen by a pharmacist in the UK. Further feedback is that it's not a holistic approach. The questions are not looking at every area covered in the module. The modules cover a large area of knowledge. We require you to learn this information and then to be able to apply this to the PSQ, which covers a specific area. This is essentially what you need to do on an everyday basis. We have students say that we didn't put the patients at risk. It is easy to get engrossed in a PSQ and forget to see the wide picture and only concentrate on the now. For example, starting a patient on anticoagulation and forgetting to stop the aspirin. Are they at risk here and now? No, not really. But long term, yes they are. They're at risk of a bleed, which is putting the patient at risk. And the other reason is to let you know that we are here for support. Illness or other reasons can affect your work. If, for some reason, whatever it is, whether it is due to work or personal issues, you are struggling to complete or even to start an assignment, do get in touch. We can support you, but you need to tell us, because if we don't know, we can't support you. So the PSQs, they're marked by a Keel tutor. The word count must be between 1,000 and 1,200 words. And as mentioned earlier, it will be sent back to you for resubmission. It is over this or under this, and resubmitted will be capped at 50%. When looking at the word count, look at the marking scheme and give you an idea what each section is weighted. For example, do not spend 3/4 of your word count on a 2-mark question when the total number of marks for the whole PSQ is 25. Referencing: if you cite any information or use information from somewhere else and put it into your own words, you must reference it. If you don't, you are at risk of plagiarism, which is classed as an act of misconduct. They must be in Vancouver style and you must do it consecutively within the piece of work. As professionals, you are bound by GPHC standards. Acts of misconduct can go to fitness to practice depending on severity and possibly subsequently to the GPHC. Plagiarism is not just rewriting word for word someone else's work, it is also submitting the same piece of work for 2 different assignments. New assignments have to be done for each module. The modules are designed to test your understanding. When doing the modules, there is an awful lot of information there, co-reading, links to further reading, etc. This can be overwhelming. It is there for your information and to decide through doing the pre-module activity what you know now and what areas you need to work on. The PSQ gets you to apply this knowledge to a real-life patient. This is the reason you are studying the module in the first place, to acquire knowledge that can be used in your day-to-day life as a pharmacist. If you go onto the KLE, go onto Student Resources, and this will bring up course work assessment examples. There's the PSQ example. Look at this. Have an idea when the submission date needs to be in. Consider all the information given in the PSQ and if it is significant when recommending treatment. Always consider current treatment the patient is on when making recommendations for ongoing treatment. Look at the marks. All PSQs are marked out of 25. This gives you an idea of the depth of answer required. For example, an 8-mark question, 1/3 of your word count would be expected to be on this section. Look at each question. How many parts are there to each question? Some questions have subsections, or there may be different parts to the same question. If you miss out one part, you would automatically miss out the marks allocated to that part of the question. There's also a PSQ answer guide on the KLE. All answers need to be Arial typeface, size 11 font, double spaced except for the references and appendices which are single lice spaced. On the cover page it's expected to have the following: name, title, assessment type, quarter, and the word count. Remember, references and appendices are not included in the word count. There is no need to put in your question again on your answer, just mark which section it is. There is also a PSQ submission checklist. If you print this out and can tick yes for each one, you should be okay. Remember, a reasonable number of references are required. Look at the handbook for help with your referencing. And remember to relate the information to the patient and justify your answers. So looking at PSQs, consider for example a type 2 diabetic patient. You want to look at treatment options. Consider all the options that are currently available for a type 2 diabetic patient. Consider each option for efficacy, safety, interaction with current drugs. Then what you want to do is relate this to the patient. So for example, if the patient had CKD with an eGFR of 25, you would relate all the options to this patient. And for example, you might say metformin is not suitable for this patient because of their poor renal function. Remember to say not just what you would give to a patient, but also why you wouldn't give an option to a patient. When considering treatment the patient is on, think, are they on the correct treatment? Is anything missing? For example, post-MI patient not on a statin, you might want to ask why not. If you decide they should be on a statin, as there are no contraindications, then you might want to consider what dose, what cost, the formulary issues, national guidance issues, license indications. When you make a recommendation, make sure you give the drug and the dose. But we also want you to think holistically. You wouldn't start a patient with a BMI of 30 on a statin and give no other advice. It's not drug related, but it is part of patient care. It wouldn't be enough just to say, I'm going to give this patient lifestyle advice. We would expect you to stay diet, Mediterranean diet, fruit and veg, 5 portions a day, exercise, moderate exercise 5 times a week. Think of risk of harm. With drug interactions, it's not enough to say that there is a drug interactions. We expect you to say how you would manage it. For example, clarithromycin and simvastatin. We need to say what the options are. You could give an alternative antibiotic or hold the statin. You need to say which one you do and why. Looking at the doses, are they being under or overdosed? Renal function, are all the doses okay for poor renal function? Frequency of administration, how often are you going to give it? It's not enough to say I'm going to give paracetamol, how frequently do you want that to be given? Obviously drug allergies, contraindicated drugs. Also clinical effectiveness. For example with this one, recommending a ACE inhibitor for a 90-year-old patient with hypertension. It is licensed for hypertension, but you are putting that patient at risk of harm because it's not the most effective treatment for an elderly person. Here is an example which you can look at. Try first to attempt to cover the main points for this PSQ and then move on to the next slide. So looking at this patient, what we'd like to know is to discuss if this patient actually needs antihypertensive therapy, and that would give you 3 marks. Assuming the patient does require antihypertensive therapy, what would you recommend, giving the advantages and disadvantages? 9 marks for that. And we'd also expect you to prepare a pharmaceutical care plan for this patient, and that would give 13 marks. So looking at the 3 questions in detail. So first, discuss whether Mr. JP requires antihypertensive therapy for a total of 3 marks. You'd want to consider the risk factors. What risk factors does he have? blood pressure, smoking, BMI, existing heart disease. We'd want you to mention the Q risk and what it is. We expect, because it is only 3 marks, to be a succinct answer. So B, assuming that he does require antihypertensive therapy, which drugs would you recommend? Discuss the advantages and disadvantages. Here you can see a question that is actually 2 parts. We would want to consider all the treatment options for hypertension available for any patient. Consider the advantages and disadvantages from Mr. JP for each treatment option. And we would expect evidence. Prepare a pharmaceutical care plan. So this is a heavily weighted question. This is 13 marks. We want to look first of all at the priorities. The priorities would be blood pressure treatment, cholesterol treatment. We want to look at monitoring, for example with the blood pressure, how frequently you'd expect the patient to be monitored, what advice you may want on the discharge letter to GP. With the cholesterol, you might want to think what the options are, what treatment, what you'd need to know before you start any treatment, such as LFTs, how often you want to measure these, how would you titrate doses, when would you measure anything again, what patient counselling would the patient need for both blood pressure treatment and cholesterol treatment. So in conclusion, with the PSQs, think of it as real life. Don't forget that there's a patient there and it's an application of knowledge. Thank you and good luck with your PSQs at Keele.